You know that feeling, that burning, nagging pain in your stomach? Is it just something you ate, or is it something more? Today, we're going to get into peptic ulcers. It's a really common thing, but honestly, it's surrounded by myths about stress and spicy food. So let's figure out what's really going on in there.
So it almost always starts with a feeling, right? That uncomfortable, sometimes really sharp pain deep in your gut. But what is that feeling actually trying to tell you? Let's dig into that sensation. Because a lot of the time, it's your body's first big clue that something's up.
Yeah, I bet a lot of us know exactly what I'm talking about. It's that gnawing discomfort, the kind that seems to pop up between meals or, even worse, wakes you up in the middle of the night. This isn't just your average stomach ache, you know? It's a very, very specific signal, and people describe it in some surprisingly vivid ways.
I mean, listen to this. People say it feels like a burning fire or a stabbing feeling, even like a heavy stone just sitting in their stomach. These aren't just vague complaints. These are real gut-wrenching descriptions of ulcer pain. It's your body basically screaming that something is seriously wrong.
Okay, so what's the actual medical reality behind all these feelings? This is where we go from just talking about symptoms to a real diagnosis. We're going to give this thing its proper name, a peptic ulcer.
So what is a peptic ulcer? Well, at its core, it's basically an open sore. See, your digestive tract has this amazing protective lining. Think of it like a shield that defends it from your own powerful stomach acid. An ulcer happens when that shield gets damaged, when it breaks down, and the acid starts eating away at the tissue underneath. Ouch.
And it turns out there are two main types. You've got gastric ulcers, which are, you guessed it, right inside the stomach itself. Then you have duodenal ulcers, which show up in the very first part of your small intestine. And while both are a big deal, it's those duodenal ulcers that are actually way more common. All right, so now we know what an ulcer is. The big questions are, why do they happen in the first place, and how can a doctor be sure that's what you've got? Let's follow the path from what causes them to how they're diagnosed. Think about it like this. There's a constant battle going on inside you. On one side, you have that super powerful stomach acid, which you need for digestion. And on the other, you have your protective stomach lining. It's this delicate balance. Ulcers happen when the defense gets weak and the acid starts winning that fight.
So, what is it that weakens your defenses? Well, it's usually a mix of things. Yeah, irritating foods can play a part, for sure. But what's really interesting is how much physical and mental fatigue matter. That's right, being stressed out and totally exhausted can literally make it harder for your stomach to produce that protective shield.
So let's say you go to the doctor with all these symptoms. How do they actually find out what's going on in there? They need a way to see that internal battleground to know for sure. Usually they'll use one of two main tools. There's the barium X-ray, where you drink this kind of chalky liquid that lights up your digestive tract on an X-ray, or there's the endoscopy. A lot of people just call it a stomach camera. It's literally a tiny camera they use to take a direct look at the lining of your stomach and intestine. Pretty cool, huh? Now, if you do get diagnosed with an ulcer, here's a number that should make you feel a little better. 10%. Only about 10% of cases actually end up needing surgery. For the vast majority of people, treatment is all about medications that either cut down on stomach acid or help rebuild that vital lining. And that brings us to, honestly, the most important part of this whole conversation: prevention. How can you actively protect your stomach? This is key, whether you want to avoid ulcers altogether or help your body heal if you already have one. The whole goal here is actually pretty simple. Instead of just worrying about the acid, you gotta focus on strengthening the shield. The whole game is about reinforcing your body's own natural protective barrier. And you know, sometimes the things that help are incredibly simple. For example, if you're feeling that hungry, acidic feeling in your stomach, something as simple as a glass of milk can help neutralize that acid and give your stomach wall a temporary buffer. It's a small thing, but it has a real immediate effect. Okay, let's bring it all home now. Because while those little actions can help, long-term stomach health is really built on consistent, healthy habits. This is where you have the most power. And check out how all these steps are connected. It's not just about what you're eating, but how and when you eat. Number 1, eat on a regular schedule. 2, choose slowly and actually relax during meals. 3, eat smaller, more frequent meals. 4, choose a gentle, balanced diet. 5, avoid smoking and alcohol. And 6, live an orderly, low-stress life. You see, it's all about reducing the burden on your stomach and creating a solid foundation for your gut health. And that last point about an orderly life, that is so crucial because it goes way beyond just your diet. It's about managing your stress, getting enough good sleep, and just taking care of your mental well-being. All of that has a direct physical impact on your digestive system. A calm mind really does often lead to a calm stomach. So, in the end, that burning, nagging pain, it's a message. It's a signal. It's your body telling you that the internal balance has been thrown off. But the good news is, you have the power to fix it, to restore that balance through your everyday choices. So the real question is, your body is sending a signal. Are you ready to listen?